Another common question is, what helps the pain after a knee replacement? Now, of course, the pain medication is vital. Talking to your surgical team, developing a pain management strategy ahead of time will go a long way in helping you after surgery. You don't want to be 24, 48 hours after surgery and trying to make decisions about pain. There's people that will respond positively to cryotherapy. That's essentially ice, whether they're using gel ice packs, whether they're using a homemade version of ice packs, or they're using what's called a cryo cuff sometimes. It's a pneumatic device that pumps cold water through a cuff that stays on the surgical knee. Any of those options are available, but it's important that you keep in mind, if you're one of those people that's sensitive to ice, if you don't like the sensation of ice, it's not a requirement. Only use ice if you feel that it's beneficial to you. Now, beyond pain meds, beyond ice, rest is a huge component. We know from clinical research that poor sleep quality or interrupted sleep increases a normal individual's sensitivity to pain. There is nobody I have ever met in 20 years that's sleeping well the night after a total knee replacement. So give yourself time, find ways to improve the quality of your sleep. There are books out there on sleep hygiene. Anything that might improve the quality of your sleep will be beneficial to reducing your pain. Certainly anything that reduces life's stressors. This is a major stressful traumatic event. If you can kind of improve or rely on your support system to help you get through this challenge, you're going to have a much easier time dealing with the pain because you're not worried about paying the bills, and you're not worried about finding food, and you're not worried about keeping the house clean. You want to build your support system before the surgery so that after surgery you have somebody or a group of people that you can rely on. Those are a couple. Obviously, there are other ways to manage pain, everything across meditation, mindfulness, hypnosis. You go out there and do the research, but the more prepared you are before surgery, the better outcome and pain management is going to be after surgery.